Hi viewers, today we will see amniocentesis. We will see the definition of amniocentesis. It's a procedure for removing amniotic fluid from the amniotic sac by inserting a needle through the abdominal wall, usually to assess the fetal health or maturity. Indications for amniocentesis. If have had a baby with a chromosome disorder, genetic condition or other disorder in a previous pregnancy. If the mother or father has a genetic disorder or are carriers for a genetic disorder. If there is a history of certain genetic conditions in the family. If other tests during pregnancy have raised the possibility that the baby has a chromosome disorder such as Down syndrome. To look for any signs of infection if membranes have ruptured early. To assess the maturity of the lungs of the developing baby. To identify if the baby is at risk of developing rhesus disease. The fetal cells that are obtained can be tested for various chromosomal conditions such as Down syndrome, Edwards syndrome, Patau syndrome. Timing of the procedure amniocentesis. Amniocentesis is usually offered after 15 completed weeks of pregnancy, most commonly between 15 to 20 weeks. This is because it has been shown to be safest at this stage of pregnancy. Amniocentesis should not be performed for genetic indications before 14 weeks because the procedure is more difficult and is associated with a higher incidence of complications like membrane rupture, foot deformities, and fetal loss. Now we will see the method of amniocentesis. A 20 or 22 gauge needle is introduced into the amniotic sac while avoiding the fetus, the placenta, and the umbilical cord. About 20 ml of amniotic fluid is withdrawn and is used for genetic analysis. Amniotic fluid contains desquamated fetal cells that can be cultured and karyotyped for detecting of aneuploidy. It's used for variety of metabolic assays for detecting of metabolic diseases like Tay-Sachs disease, detecting of CAH, that is congenital adrenal hypertrophy, Gaucher's disease. It's used for DNA extraction for detecting of cystic fibrosis, Fragile X syndrome. It's used for FISH technique. FISH means fluorescent in situ hybridization. Amniotic fluid alpha fetoprotein can also measured. It helps to detect neural tube defect, duodenal atresia, omphalocele, exomphalus, etc. Complications after amniocentesis include vaginal spotting and amniotic fluid leakage, fetal loss about 0.5%, failed procedure 1%, cultural failure less than 0.5%. Thank you. Have a nice time.